In accordance with the Constitution and laws of the state of Texas,
The 87th Texas Legislature is underway, facing a budget deficit and modifications due to the coronavirus pandemic. Everyone attending opening day took rapid COVID-19 tests in a tent before being allowed to enter the Capitol. A smaller than normal COVID-limited crowd gathered for the opening session's proceedings. Though the pandemic brings some uncertainty to the legislative process this year, TMA nonetheless has prepared a patient-focused agenda. Prior authorization reform is one of the top priorities.
Prior authorization is something that's grown to the point where it's out of control. Particularly, we've noticed growth during the pandemic. It is part of utilization management and a tool that payers use to try to control costs. However, we understand that prior authorization has gotten so challenging that frequently it leads to patients abandoning care, having delays in care, and sometimes having an adverse outcome.
I think on average, doctors tell us that they wade through 31 requests for prior authorization a week. And none of these is a very short process. It is time consuming, it delays care. It often leads to frustration on the part of patients who abandon treatment or out of further frustration, pay for it out of pocket if they can't get a timely approval.
We'd like to make sure that the state doesn't require prior authorization for diagnostics or therapeutics that are already mandated to have state coverage. For example, women are permitted to have screening mammography. That's a guaranteed benefit by the state. So for it to have to go through the prior authorization process is a challenge. We want to make sure that prior authorization is an appropriate barrier and that doctors can get other doctors of similar specialties that understand the issues at hand to address issues in a timely fashion. So we'd like for prior authorization peer-to-peer review to be available 365 days a year, 7 days a week. So that way we can get timely approval for the procedures and the diagnostics that patients need. The natural consequence of not having these things move forward is that patients are delayed in their care, and frequently patients can have an adverse outcome. Obviously, we want to look out for the best interest of healthcare in Texas, and in order to do that, we need to make sure that patients get the timely care that they need.
TMA hopes medical office staff can spend less time getting prior authorization so patients can get timely, necessary care. Several bills are being readied for introduction this session. We will report on their progress as the session goes on.